Can a simple stretch stop lower back pain instantly? Whether caused by poor posture, prolonged sitting, or sudden movements, it can interfere with daily activities and reduce overall quality of life. Many people seek quick relief from this discomfort, leading to the question, can a simple stretch stop lower back pain instantly? While stretching can be highly beneficial for pain relief, its effectiveness depends on the cause of the pain, the type of stretch performed, and individual body conditions. The role of stretching in lower back pain relief. Stretching is a widely recommended method for alleviating lower back pain. It helps increase flexibility, improve blood circulation, and release muscle tension. When the muscles surrounding the lower back become tight or imbalanced, they can pull on the spine, causing discomfort. By stretching, individuals can reduce tightness and restore mobility to the affected areas. However, expecting instant pain relief from a single stretch may not always be realistic. While some people experience immediate relief, others may need consistent stretching over time to see noticeable improvements. The effectiveness of stretching depends on factors such as the severity of the pain, the underlying best stretches for lower back pain. Certain stretches are particularly effective for relieving lower back pain. Here are a few that can provide quick relief. Child's pose, a gentle stretch that relaxes the lower back and elongates the spine. To perform this stretch, kneel on the floor, sit back on the heels, and extend the arms forward while lowering the chest toward the ground. Knee to chest stretch. This helps loosen the lower back muscles. Lie on the back, pull one knee toward the chest, hold for 20-30 seconds, and switch sides. Cat-cow stretch, a dynamic movement that enhances spinal flexibility. Start on hands and knees, arch the back while lifting the head cow position, then round the back while tucking the chin cat position. Seated forward bend. This stretch targets the hamstrings and lower back. Sit with legs extended, reach toward the toes, and hold the position. Piriformis stretch, useful for those with sciatic-related pain. Lie on the back, cross one ankle over the opposite knee, and gently pull the thigh toward the chest. When stretching may not provide immediate relief. While stretching can be highly effective, it is not a cure-all. Some cases of lower back pain result from conditions such as herniated discs, arthritis, or nerve compression. In these situations, stretching alone may not provide immediate relief and could even aggravate the pain if done incorrectly. It is important to listen to the body and avoid forcing movements that cause discomfort. Additionally, combining stretching with other techniques, such as strengthening exercises, posture correction, and heat or ice therapy, can enhance pain relief. Regular movement and maintaining a healthy weight also contribute to long-term back health.